WeInfuse Podcast, episode number 78. Welcome to the WeInfuse Podcast. My name is Amanda Brummett. In every episode, we give you a seat at the table as we talk to infusion center owners, operators, and experts so that you can get the insight you need to run a thriving practice. In this episode, we talk with our own Bryan Johnson, CEO and co-founder of WeInfuse, CEO of RxToolKit, and CEO of InfuseTrack. Bryan shares how their new software, InfuseTrack, brings clarity, control, and confidence to equipment management for infusion centers, specialty pharmacies, home infusion providers, and hospital outpatient departments. Bryan, thank you so much for being here today. It is great to have you back on the show. It's been a few years, right?
It's been a long time since I was on a podcast. Yeah.
Yeah. Well, I know a lot of our listeners probably already know you, but give us the elevator pitch on who Bryan Johnson is,
Yeah.
how you got into healthcare, and more specifically infusion.
Happy to. Yeah. It's a long story. I haven't done much else with my career. I was in college and I had a business mentor that I was introduced to who was starting an infusion business. And I didn't know what that was, but I went and met with him in his office. This was back in 2002, 2001, when infusion was kind of not even a word, I don't think yet, but people were starting these outpatient infusion centers in physician offices. And that was his company. So I told him, hey, I really don't want to be in healthcare. It wasn't my thing, but I
Yeah.
like IT. So I'm happy to, if you'll share business with me and help me be involved or let me be involved in your conversations and teach me, I'm happy to help out on the IT side, websites, marketing, email, things like that. So I did that for some years. When I graduated, he invited me, said, hey, why don't you come work for us? We need someone in sales and marketing and help us with our systems. So I went to work. The company was called Innovative Infusions. It was kind of infusion before it was cool. So spent several years there helping to grow that business, left and did more of like a franchise with that original company in Austin, Texas, and started what would become the Austin Infusion Centers and opened those and ran those here in the Austin, Texas office. Fast forward a few years, the company grew across the state of Texas, and we sort of Reece, who is my now co-founder, if you guys know Reece Norris, was doing the corporate law thing, decided to, hey, I don't think I want to keep doing this. And I said, well, I need you to come over and help me because I have this infusion thing and it's getting really hairy. And so he came in and we kind of merged and rolled up all these franchises under that Innovative Infusions umbrella. We had infusion centers operating all over the state of Texas, some of the first standalone infusion centers in the country, a model that
Wow.
Reece kind of helped us put together, and under his leadership, we were able to grow the business. Around 2000 and I think it was 12. Amanda, don't quote me. It's in the bio somewhere. We were approached and we sold that company to Paragon Healthcare. What was Paragon Healthcare,
Oh,
Texas? So they didn't have infusion centers, and Rick Allen had the foresight to see this was going to be an important business, so added it to their home infusion, hemophilia, kind of specialty pharmacy business they had going then. So back up a little bit, 2010, Reece and I co-founded the National Infusion Center Association, which is NICA, for the audience
amazing.
know. We didn't know what that would become. We knew there was a need in the industry to kind of pull this new group of folks together. And then subsequently, later on, in the later 2020s, founded the Infusion Access Foundation off of that as well. So very involved. Spent 4 years at Paragon. Did great. We had developed a proprietary system before we sold the company to Paragon called Drip Sync. It was a software we had created to run the business. And so looking back on that, we said, hey, what did we most enjoy? Or where do we think we can multiply our knowledge and scale that? And we thought the software was probably the best way to do that versus opening up, another 100 infusion centers, because that's hard. And we weren't
Yeah.
ready to do that then. So we founded DripSync and went live in our first office in 2016, I believe, up in the Dallas, Texas market. They're still a client.
Wow.
And they've just been growing from there. Reece always said it was a 10-year overnight instant success. Along the way, met Chuck and his team in the RxToolKit side and
Yeah.
just loved what they were doing. We were super excited to partner with them, and then had a conversation with Chuck. We made an acquisition of RxToolKit a couple of years back, added that to our company and our team. It's just been a great acquisition. And now we're on to InfuseTrack. So just onward and upward, let's say.
Yeah. Okay. So it sounds like solving infusion pain points is almost a superpower for you and Reece with WeInfuse, RX
Or hers.
Toolkit.
Yeah,
Yeah,
depending on
for
how you
sure.
look at it.
So, what was it when you were out and about in all your clients' infusion centers? What did you see that made you say, we've got to do it again? We have to go create a product to fix this?
Well, we had our own infusion center still at Paragon, and just
Mhm.
watching, again, there was a software in place. It had gotten
Mhm.
long in the tooth. We decided, or at least the company decided, not to retail that software out as a solution for other folks. So it
Mhm.
really became kind of a proprietary in-house solution.
Mhm.
We just, through NICA and through everything else we had going on, we just saw that this was really a problem industry-wide, and we
Yeah.
saw tailwinds coming in terms of more and more biologic drugs coming through the FDA that were infused only, that were gonna be provider office drugs, and site of care optimization swings that were pushing patients out of the hospital. We said, "Man, this is really gonna be a thing where there's gonna be this massive industry, and there's really nothing to help pull it together." Everybody was still struggling with systems, and so that was really what got us excited about, hey, we could, now that we've built one solution before, you kinda know, we always say it's like if you ever build a home and you live in it for a while, you would love the home, it's great, but if you ever built a second home, this
Mhm.
time you do it, you're gonna be a little smarter. Like, "Hey, that laundry room needs to be a little bit bigger. I need one more half bath." You learn a lot from that first experience, and we had learned quite a bit from our first software and said, "Man, we could do it again so much better." And there was more technology. There have been a lot of advances in SaaS software, cloud, and whatnot, and we were just real excited, like, "Hey, let's give this a go." So, like entrepreneurs, it's a little, you don't really understand how hard it's going to be, and you say, "How hard can it be?" Which is a funny quote me and Reece always say to each other, and then what we thought would take a year to 2, probably 2
Sure.
to 5 years, and with most of the things we do, that's how it works, but you just
Yeah.
delude yourself into thinking, "How hard could it be?" And you just do it anyway, but
Right.
so that's the WeInfuse origin story, at least on that side.
Okay. And then when it comes to InfuseTrack, what were you seeing in the market that told you, "Okay, we've gotta do it again. We've gotta create a solution for this."
Yeah, InfuseTrack was an accident. WeInfuse has, we added on a claims RCM software about 4 or 5 years ago. I've been developing that. We added on a pharmacy system that is pharmacy for both like home infusion and specialty and infusion centers that have their own pharmacies. So we were in the midst of that, and one of the things that kept coming up was tracking infusion pumps, mainly the portable kind that go to a patient's home for home infusion, things with inotropes and TPN, parental nutrition kind of buckets, antibiotics, and so on. And so on the side, I started just kind of vibe coding that up on the product side to help our pharmacy team. Said, "Hey, I'm going to just kind of get this going and figure out the workflows. So when it comes time to build this in the pharmacy app, we have something to run off of." And as I started showing that to clients, current clients and prospects, we kept getting feedback of like, "Hey, this is great, but hey, can you also track my infusion center pumps that are on the wall?
Mm.
Can you track my equipment, my IV poles, my chairs, my vein finders, my blood pressure cuffs? Can you help me with inspections, monitoring, certifications, licensing, tracking?" And so as I started stacking more of this in there as kind of an idea pile, we looked up and there was a whole navigation bar in this Vibe app. I was like, "This is a whole app." And I had that was one of my roles at Paragon when they're in the acquisition, was I was in charge of a lot of the facility, especially provisioning of facility equipment and things like that, pumps across the company, supplies, certifications, contracts. And so I'd suddenly just all flashed back to me of all the things I used to keep on a spreadsheet back in my Paragon days. And that's really where it came from. As we talked to clients, we were prospecting this idea around was, "Hey, what else are you tracking that's not already in WeInfuse or RxToolKit?" WeInfuse is a full system of records, lots and lots of capability. RxToolKit is clinical education and policy, and you know eh, just a lot of good clinical decision making tools in there. But where, what about everything else? And so everything else kind of fell in these buckets. A lot of asset tracking, compliance, and these are sort of the unsung heroes in this company are doing it. It all kinds of flows to accounting. So we just start stacking that in, and at some point we're like, "Hey, let's." I hid it from everyone in the business for about 6 months. I wasn't sure it was worth our time, and then I brought it to Reece and the team and said, "Hey, I think I have something here that might be similar to Arch Toolkit, a standalone logo, a service that will both integrate with our current softwares, or it could be a standalone product." And we got a trade show booth at NHIA. We demoed it and had an outstanding response and said, "Okay, we're onto something here." And so now we have a dedicated dev team and a dedicated, marketing and sales team around this. It's exciting. Apparently, it is needed. So
Yeah.
well,
Okay,
we'll see on
so
the podcast next year how we did, Amanda, but I think it's gonna work.
yeah, one year from now, we're gonna check in on that.
Right.
So, from an efficiency perspective, no-brainer, right? We all need to have good inventory of our equipment, but can you give me some examples about, like, the potential risk in not knowing where your stuff is or not having things available, unnecessary costs? Like, what's the business case?
Yeah. And I just start collecting some of these pain points as we talk to folks, current clients and prospects, because they're giving me lots of good stories. Pumps and just starting with infusion pumps, they're very expensive. I mean, these are all thousands to thousands of dollars of devices. They're heavily regulated in terms of the need for them to be biomed certified annually, for them to work correctly. There's all kinds of maintenance and leasing and just a lot of complexity around pumps. And
Mhm.
so losing track of them, of course, is a big deal. And so I was just actually at a client's office. We were visiting, doing an on-site and going to a couple of their different infusion centers. And I walked in with one of the facility supply chain guys. And while we were in the back room of this infusion suite, there were two IV pumps just laying on the floor, wrapped in plastic. And, I walked to watch him like, hey, what are these doing here? I was asking
Mhm.
the nurse or the center director. And she said, I don't know. Some guy dropped those off the front door like a month ago. And I just set them back here on the floor. So what had happened was those pumps had been sent out to the biomed vendor who was certifying the pumps and doing their annual maintenance, and
Mhm.
they were supposed to go back to either the headquarters or another infusion center. I don't know what, but the address got mixed up. They FedExed them to the wrong facility. Well, the nurse just got them and set them on the floor. Nobody had any idea where these pumps were, and this was about $3,000 or $4,000 worth of equipment just sitting on the floor. So, and again, I'm with the guy who's supposed to be tracking this stuff. It's on a spreadsheet somewhere, but he didn't even realize they had been sent back. And so, this kind of thing, I recalled a lot of memories for myself and my own challenges of getting pumps back from patients, pumps that are lost in shipping, pumps that are on the wall at the infusion center or on a pole, but they're due for maintenance, and we're finding out that the sticker's not on there, and the state board shows up or the pharmacy inspector shows up and finds you have a pump out of certification. That's a big deal. So
Mhm.
anytime you're tracking a lot of things with a lot of values on them, just doing it on a spreadsheet, usually having only one person in the company own that is just very risky. So we really wanted to put something together that was technologically advanced, that had kind of the "Hey, stupid" function, kind of the red. We always say the red, yellow, green,
Yeah.
and also something that was organizationally visible. So should your supply chain person not show up to work tomorrow or go get another job, there's someone can step right in instead of it being something that's on their desktop or in a SharePoint somewhere. And all the clients we talk to, this kind of thing is typically just spreadsheet tracked. So
Yeah. Very people dependent, not process dependent. So, how does your platform work differently? Do you pop an Apple AirTag on everything and is it all automagical? Tell us
we
about
are
how
we
it
are
works.
working on some of that. Really, so high level, it's tracking, a lot of physical assets and
Mhm.
tracking things on those assets, like their certifications there. If you do asset tags, we can incorporate those. A lot of this equipment already have serial numbers, and so they have
Mhm.
Zome, and that integrates with our Zebra barcode scanning, 2D, 3D, 1D, whatever it is, we do in our app already. And so we're integrating with that process just to make it easy on the user with existing systems. We are working with companies that do physical asset tracking to incorporate that. One of the things we do, every one of our clients, whether they're a pharmacy or a physician's office or an infusion center, have refrigerators. Some of them have freezers. A lot of them have ambient cabinets and things like that, clean rooms, ante rooms. And so it's critical they track temperatures in those and temperature range. So traditionally, that's kind of a kitchen style temperature sensor or whatever thrown on the shelf. And there's a clipboard, magnetic clipboard on the front of the fridge with a log, and someone writes down every day, the temperature in the fridge is 39 degrees, and then that is scanned in somewhere or it's kept on a spreadsheet, like I said. So there are several companies we're working with. I won't name them here on this podcast, but they know who they are. They haven't signed our deal yet, so please do that soon, where we are looking to incorporate their digital devices, their cellular, their network devices, and that will also track
Ooh.
directly in InfuseTrack. So anywhere we can incorporate third-party technology for asset tracking, environmental monitoring, and that includes temperature, humidity, pressure, we're bringing all those in. So the big thing is getting it all into one place. A lot of people think about refrigerator temperature monitoring and pump tracking and a DEA license and a nursing license all in the same concept, but these are generally all in a couple of folders in the compliance bucket somewhere on some company shared drives. We just want to bring them all to one place where that visibility is there for everyone. And you log on, and if it's red, deal with it. If it's yellow, it means you got to deal with it soon. If it's green, you're in good shape. So the inspector shows up, you can click a button, you can see everything's insert, you can see the monitoring, everything's in compliance, and everyone kind of knows where everything is. So
Great setup. So, thinking from the owner operator perspective, where do you see the biggest ROI when an infusion center implements something like InfuseTrack?
Yeah, I mean, if you're a one location infusion center, infusion suite, you probably are doing a pretty good job of keeping up with things. And you can walk over in the space, look at it and keep track, put it on a spreadsheet. I think as our clients or prospect is scaling up and you're getting to 2, 3, 4 locations, especially when you're getting locations that are sort of disjointed. So they're not geographically together where it's harder to go put eyes on things. I think that's where the biggest ROI and value comes because instead of having multiple folks tracking things, having to call your infusion suite, say, hey, have you looked at this lately? Have you seen it? Can you go take a picture of it? You're now involving the staff in the process. And that's something that the software is designed to do is keep that situational awareness. So the staff at the local facility is encouraged and we make it very, very easy for them to manage their compliance. Again, log in on the dashboard. If something's red, address it. If something's green, you're good. If something's yellow, you've got, inspection coming up soon or a pump due for its annual PM, but just keeping everybody on the same page so that the corporate office staff, again, if that's one person or 10, is not saddled with all that work and they're having to get on planes and cars and drive and check on all these things. One of the stories I always tell is every time I would physically go visit one of our infusion centers when we own and operators, I would always find things out of non-compliance. The pads weren't in the AED box. The AED battery had expired. The oxygen tank was empty. The ambu bag on the oxygen tank was expired and it wasn't connected. So really try to design the app around, hey, this is your facility. Your facility needs to be green every day. And if you're green, everybody's happy. And that's how we push kind of the behavior management in the app to keep everybody on the same page. But again, the greatest ROI is that you've got this consistency and scalability of a compliance asset tracking software that should be able to be managed by a single person. And so when you get 10, 15, 20, 100 facilities, you're still able to see everything, make decisions. All this reporting drops back into our analytics suite that our current clients are very familiar with. And so just having all that one place is a huge advantage to the lost spreadsheets. And not
Yeah.
to hate on spreadsheets, but it's not something that scales well and organization grows.
Right. What does onboarding look like? How do you get all those expiration dates in? How do you get all those barcodes in?
We have learned our lesson with WeInfuse. And so we have clients with thousands of pumps. We have clients with 5 pumps. So depending on your size, we do have an import process. Good news about the spreadsheets is if they're accurate, we can import them all. So we'll be,
If they're accurate.
we do have a import function that's already baked out. And that will allow you, if you've got, 1,000 pumps on a sheet with serial numbers, model numbers, your lease agreements, whatever, we can bulk pull that in. We can pull in your pump certification images and whatnot. We're kind of learned how to do that with WeInfuse when we go live with clients who are on other solutions. So our team is ready and willing to do that so we can hit the ground running. Training, this is definitely a what you see is what you get software. So there's the pump. It's either, again, red or green, right? It's insert, it's not insert. You're supposed to get it back from the patient. You haven't seen it. There are going to be several integrations around shipping and last mile logistics. So if you have couriers moving these around, all of that will be integrated as well with our partners like VirtuScript and some of our other partners that are on our page. Yeah. Shout out to VirtuScript here because they've got a great system if you're not already using it. But that'll
Thank you for
handle.
the plug there, Bryan. If you guys are not familiar with VirtuScript, go check out episode 75 of the WeInfuse podcast.
Oh, there you go.
So, Bryan, if people are pumped and want to be some of the first to get a sneak peek of InfuseTrack, how can they set up a demo with you guys?
It's great. They can reach out at sales@infusetrack.com. You can also reach out to sales or support at WeInfuse.com or email me directly. Anyone on our team is going to funnel you to our team so we can set that demo up. It's about 8 to 15-minute demo, and we can do that virtually. Or if you are going to the National Infusion Center Association trade show coming up in July, we will be there. So come and see us.
And do people need to be a WeInfuse client to use InfuseTrack, or can they use it as a standalone product?
The answer is yes. Very similar to RxToolKit. You do not have to be a WeInfuse client today to purchase and use InfuseTrack or RxToolKit. You can use it as a standalone product. We are looking at some other integrations with some other applications for this, but it works just out of the box for all these things. However, if you are a WeInfuse customer or a client of ours, we do have a pretty tight integration. That's where you're really going to get the most value because you're going to be able to have the same user login for WeInfuse that works for RxToolKit, that works for our WeInfuse U platform, and all of our applications. You can use that across your whole organization. SSO for the technical folks on the call. And you're going to have direct access when you assign a pump to a patient inside of WeInfuse. You immediately then will be able to see that outcome in InfuseTrack and vice versa. So really giving you that kind of whole company view of things.
That sounds really seamless. Very exciting. Hey, speaking of exciting, Bryan, what are you most excited about in the industry right now?
Things I'm most excited about. I say this all the time, at least for myself personally and my team. I know we always say we're never going to run out of interesting problems to solve. The industry is changing. So whatever we've solved today, tomorrow, insurance companies or again, pump technology or just technology in general is going to throw us a curveball. In this space, there's just always a new challenge. And so that's fun for us. We enjoy those challenges. We wish we could say yes to every feature request to every client, but it just doesn't work that way. But I'm just most excited about how we're able to integrate some of this new technology into healthcare. Healthcare is notoriously behind. We're chasing it as much as we can. But we've got some really fun and interesting things, both for WeInfuse, RxToolKit, and InfuseTrack that we're going to be incorporating here. So 2026 is going to be a lot of fun. So stay tuned to the WeInfuse podcast and for updates.
Yeah, well, and big thanks to you and Reece for being those humans in the room that see a problem, and instead of just complaining about it, you say, we could fix this. So,
well, we can try to fix it, Amanda. That's what we're going.
That was great information from Bryan Johnson about InfuseTrack, the new software from WeInfuse that brings clarity and control to equipment management for infusion centers, specialty pharmacies, home infusion, and hospital outpatient departments. With InfuseTrack, you can track your pumps, chairs, IV poles, vein finders, temperatures, certifications, licenses, and inspections all in one place. Dashboard tells your team exactly what needs attention today, what's coming up, and what's good to go, so a lost pump or an expired certification doesn't catch you by surprise, especially as you scale to multiple locations. Schedule a test drive by emailing sales@infusetrack.com. And while you're at it, check out WeInfuse and RxToolKit. These tools save time and money in your center while making infusions safer for patients and caregivers. My name is Amanda Brummett, and we'll catch you in the next episode.